Hi everyone, welcome to PharmaGrid. So today we will continue with the remaining recalls discussion series. Question number 11. Identify the structure of propylene glycol. Here the correct answer is option B. Propylene glycol is a synthetic organic compound with the chemical formula C3H8O2. Propylene glycol is a colorless liquid that is relatively viscous, has no odor and tastes slightly sweet. It is hygroscopic, meaning that it readily absorbs water from the surrounding environment. As a humectant, emollient and preservative, propylene glycol holds moisture while preventing mold in certain medicines, cosmetics and foods. As a solvent, it helps improve the texture and consistency of foods, drugs, paints and more. A side effect of mRNA vaccine. The options are hypertension, secondary infection, pericarditis, diarrhea. Here the correct answer is option C, that is pericarditis. The FDA added a warning label on the mRNA vaccines regarding serious but rare cases of inflammation of the heart muscle, which is known as myocarditis, and of the outer lining of the heart, which is known as pericarditis, in adolescents and young adults, more often occurring after the second dose of an mRNA vaccine. If plasma protein decreases, all can happen except the options are edema, decreased immunity, bleeding, multiple myeloma. Here the correct answer is option D, that is multiple myeloma. Symptoms of low blood protein or hypoproteinemia are edema is also referred to as water retention, easy bruising, slow wound healing, prolonged blood clotting time, reduced energy and muscle wasting, skin rash, brittle nails or nails with ridges on them, loss of hair, scaly skin, depression, fatigue and lethargy, abdominal pain, headaches. So all these are symptoms of hypoproteinemia. In the question we need to find out the exception. Hence came the answer as option D, that is multiple myeloma. The class of dipyridomoles. The options are anti-epileptic, antiplatelets, anticoagulant, antihyperlipidemic. Here the correct answer is option B, that is antiplatelets. Dipyridamole is a non-nitrate coronary vasodilator that also inhibits platelet aggregation. Is combined with other anticoagulant drugs such as warfarin to prevent thrombosis in patients with valvular or vascular disorders. It is also used in myocardial perfusion imaging as an antiplatelet agent and in combination with aspirin for stroke prophylaxis. Mechanism of action of atenolol in angina. The options are increase heart rate, decrease oxygen demand, increase heart rate and oxygen demand, decrease heart rate and decrease oxygen demand, decrease heart rate and increase oxygen demand. So here the correct answer is option C, that is decrease heart rate and decrease oxygen demand. We know that this atenolol is a cardioselective beta-1 adrenergic antagonist. Selectively binds to the beta-1 adrenergic receptors in vascular smooth muscle and the heart. This selective binding blocks the positive ionotropic and chronotropic actions initiated by endogenous catecholamines such as isoproterenol, norepinephrine and epinephrine. As a result, sympathetic stimulation is inhibited. This activity results in a decrease in heart rate, blood pressure and myocardial contractility. By reducing the heart rate, the force of muscle contraction and the blood pressure against which the heart must pump, atenolol reduces the work of heart muscle and the need of the muscle for oxygen. Since angina occurs when oxygen demand of the heart muscle exceeds the supply, atenolol is helpful in treating angina. Okay, so the mechanism of action of atenolol in angina is to decrease the heart rate as well as decrease the oxygen demand. So we have completed today's recall series. Thank you everyone. Have a good day.